Okay, good morning, everyone. We will go ahead and get started this time. Thanks, everyone, for being here, for those of you who are in Wichita, and thanks to those of you who are joining via webinar. We're very excited to tell you about a grant opportunity and answer questions that you may have about the grant opportunity. I'm Jeff Willett, Vice President for Programs and Policy with the Kansas Health Foundation. And there we go. And joining me today will be Alina Alterman, who's a program officer with the foundation, and Bonnie Mazza from TCC Group. I'm just going to set the stage, very big picture, talk about this initiative and why it's important to the foundation. Alina is going to walk you through the RFP, provide more detail regarding the purpose of the grants and how you can apply. And Bonnie's going to talk about an important component of the process, which is the CCAT, the Core Capacity Assessment tool that TCC Group has developed. So this is the team that's going to be talking and answering questions. I also want to acknowledge the very important role of Valerie Black, who's handling all the IT for us today, and will help ensure that we're able to record this webinar, post it on our website if you want to go back and listen to it again or point others to it. Also in the room we have some other foundation staff that I just wanted to quickly acknowledge. Steve Cohen, our President and CEO, Deanna Van Hirsch, Elisa Buller, and Jeff Usher right there. I think that's all the foundation staff. Oh, Nadine's out front, and thanks to Shannon and the other folks from the Leadership Center for helping. Let's have a great space to hold this meeting in. So, could you advance the slide? Sorry about that. Sure. So this is the kind of framework that I talked about. After Alina and I present, we're going to stop and see if you have any questions, initial questions about the initiative. Then Julie will present, and we'll stop, see if you have questions about the CCAT, and then open it up for any other questions. We've got 2 hours this morning, so you definitely can have all of the time that you want for either questions at the group, or if you want to talk to any of the foundation staff afterward, that would be fantastic. Valerie, if you could go ahead one more slide. This slide represents the strategic framework of the Kansas Health Foundation. Our board completed a strategic planning process about a year ago, and this is now the framework that guides our grant making, our policy work, and our communication. And basically what you see here is two overarching program areas. One we call Health Equity, and that includes activities that are intended to reduce health disparities related to social and economic factors. And this project is squarely in that space. We also have a civic health program area, the goal of which is to engage Kansans to improve the health of our state. Through that work, we support leadership development, capacity building, we support nonprofit journalism, and also develop information for action through grants to the Kansas Health Institute and other research partners across the state, including Wichita State University. Sarah Jolly is a member of our research and evaluation team through Wichita State. So again, this work falls on the health equity side, and just real briefly, we believe that in order to reduce and eliminate health disparities in Kansas, we need to kind of support action at three levels, or at three different points. One, when people are sick, when people need health care, we want to ensure that all Kansans have access to affordable, quality health care. Second, we know that tobacco and obesity disproportionately affect lower-income Kansans, create a tremendous amount of early disease and death in our state that disproportionately affects certain communities. So our prevention work is designed to reduce tobacco use and obesity, and reducing obesity by increasing opportunities to access healthy foods and have safe places for physical activity. This work helps us expand beyond those 2 points into what we call determinants of health, or social determinants of health. And in the RFP, you have a list of potential issue areas that you can apply to focus on through these grants. That list is not exclusive. We're open to other ideas as well. But Valerie, if you could just go forward 2 slides. This is the list of issue areas in the RFP. So with regard to determinants of health, we know that where you live, where you grow up, the opportunities that you have an incredible impact on your future health outcomes, your future economic outcomes. So through this RFP, we're open to proposals that would focus on some of those social and environmental factors like education, housing, and the environment. We also know that who you are play a big role in health outcomes. So this RFP would also allow you to focus on a community or a population that's disproportionately affected by poor health outcomes. So people with disabilities, people with lower levels of household income, racial, ethnic groups, etc., can have poorer health outcomes depending on what you're looking at. And also, just the systems, our criminal justice system, our health system, all can play a role in alleviating health disparities and addressing determinants of health. So this is a list of potential areas that we would support organizations through these grants. Again, this is not an exclusive list, and Alina will talk a little bit more about that. So with that, I'm going to turn it over to Alina, who will walk us through the RFP.
Sure. All right, thank you, Jeff, and thank you guys all for coming. So the vision for this project, the Health Equity, thank you, a little shorter, for the Health Equity Partnership is we know that there are organizations working on health disparities, working on the issues related to health disparities. That's what you all do. And we believe that the stronger the internal capacity of those organizations that are working on health disparities and the better connected they are to one another, the more robust the health equity movement will be in Kansas. There's already a movement happening. We just want to make it bigger, bolder, stronger. And we envision an environment where all these different organizations are connecting with one another. They're connecting with us. They're aware and hopefully supportive of one another's efforts and what everyone's doing.
Welcome to the webinar. You have entered as an attendee.
Power together. So as Jeff said, for this project, the applicants will propose to address systems and policies that address health disparities within one issue area. This list is not limiting. These are just examples. There are obviously a lot of other health disparity issue areas that are not included here, and we're open to anything. But the applications do have to go under an issue area. So it's a 3-year initiative. During the first year, we're really focusing on capacity building, strengthening that internal organizational capacity. The focus is going to be on nurturing leadership, on building up the organization, and strengthening connections and building new connections, strengthening existing connections with one another, with the other organizations working within that issue area the organizations are working in, with us. And then during years 2 and 3, we're going to continue with the capacity building, but also at that point start implementing advocacy campaigns related to the issue areas and strategies to advance health equity. So the structure that we're envisioning for this initiative is that there will be up to 10 grantees, and the applicant organization is going to be the lead organization, but then they're going to have partner organizations that they work with. And they're going to be engaging those partners throughout their work, and kind of in that spirit, we're asking for applicants to provide letters of support from other organizations with whom they hope to work with on this issue area and during this initiative. So as you can see, here's just one example. One partner working with 5 partner organizations, and we know that depending on the issue area, there might be more, there might be less. But if you can envision then 10 of these and the power that that builds and the collective impact that would have. So during the first year, again, the funding is really focused on building organizational infrastructure capacity. And some of the examples of the activities are developing a plan for financial sustainability, supporting the development of a strategic plan, communications plans, organizational membership and grassroots organizing capacity. These are just, again, some examples. And then during years 2 and 3, again, continuing with some of the work from year 1, but then also implementing the policy and the system campaign related to issue areas. The way that we're structuring this is that we recognize that things change year to year, things change month to month, week to week. But what we're going to do here is the application that you all have in the RFP, that is your plan for year 1. And certainly you talk about the issue area and some of the work that you're going to do, but the focus is really on the capacity building. What we're going to do is that in collaboration with the other grantees, with KHF, other partners across the state, grantees from this initiative will plan out their objectives, their deliverables, their activities for year 2 towards the middle end of year 1. And then same thing, they're going to plan out what they're going to do in year 3 during year 2. Because recognizing that you may not know what's going to be happening within the issue area now, and what's going to be happening 3 years from now. So who can apply? Applicants do need to be non-governmental incorporated nonprofits. We want folks that are really demonstrating credibility in the area in which they're proposing to work. I think some of that you can see is infused within the RFP. Really folks that are connected and involved in the communities in which they're proposing to work. And also folks that are well positioned to build networks and momentum, folks that have experience building advocacy and collaborating with one another. And some of the funding determinations, a clearly articulated vision for capacity building. That's a third of the points of the application. It's really the vision for the first year. How will this money help you build the organizational capacity and achieve the organization's mission and vision? Again, experience in being part of a collaborative network or coalition, being representative of a population affected by disparities, really being involved in those communities, experience mobilizing folks, accelerating change, and utilizing advocacy and grassroots organizing to affect change. As this is a 3-year initiative, there's $300,000 available maximum per organization, with a maximum of $100,000 per year. And the initiative begins December 1st of this year and ends November 30th of 2019. The letter of intent is due at 5 p.m. on the 22nd. Any application that is submitted that doesn't have a letter of intent will not be reviewed. And the letters of intent have to include the name and address of the organization, the primary contact, the issue area that the organization is proposing to address, and the organizations that the applicant anticipates partnering with. Once you submit the letter of intent, you'll receive an email from KHF, and that email will have the link to the online proposal form. And then we're also going to forward the letter of intent to TCC Group, and then TCC Group will send that primary contact person a personalized link to the CCAT. So basically, as soon as you submit the letter of intent, you'll get the CCAT link. And then just a quick note regarding lobbying. KHF only supports lobbying for issues that our board has approved. So currently that's Medicaid expansion, dental therapists, federal reauthorization of child nutrition, and increasing funding for public health in Kansas. During year one, grant funds are not to be used for lobbying, and then any future use of grant funds would have to be, for lobbying, would have to be approved by KHF. So the timeline, the letter of intent, deadline is some time, it's coming up, August 22nd by 5 p.m. After that, the proposals are due October 14th, trying to give you guys enough space in there between the letter of intent and the proposals to complete the CCAT, to have a call with TCC group that Lonnie will explain, and then have enough time to write the proposal. We'll announce grant awards November 11th, and like I said, the grant begins December 1st of this year and ends November 30th of 2019. And then for the scoring, as you can see, it's worth 45 points, and again, a third of the points is the vision for capacity building. In addition, we have the applicant's capacity and experience, the issue area. We're asking that folks talk about how your issue area intersects with the two other issue areas to really make sure that, you know, this is a really kind of intersectional project. We are all interdependent. And then obviously the objectives and the budget are also scored. And then for any more information, we'll have Q&A right now. We have our website, which includes, we're recording this webinar right now, so that will be up there. We have links to attachments that are up there, and we have a list of frequently asked questions that we're updating at least two times a week. So if you have questions, it's possible that someone's already asked them, and they are on that list. If you have any questions regarding the initiative, you can always email me. My email's up there. And then if you have any questions regarding the application process, Blair Weibert is the person to contact, and that's her email address. So, Q&A?
Yeah, Q&A. There we go. Okay. We want to make sure that people, generally speaking, understand what we're talking about before we move on to the CCAT. So we did want to allow you to ask some big picture questions now if you have them. Yes, sir.
I'm saying about
We'll pass around the mic so the folks on the webinar can hear, and I think we'll try to unmute everyone on the phone. So if those folks can mute your phones so we don't hear dogs barking and violins playing, all that stuff, that would be great. Yes, sir.
So I'm Sam Brown with the Hugo Law School. I'm Institute Director. Question I have is around the non-governmental, non-profit organization. So where's the university?
For this initiative, we consider a university to be a government entity.
Them up to not have to play the facility.
So the focus is on non-profits, non-governmental, including universities as a governmental entity. But partnering, we would anticipate there will be many partnerships and a great deal of engagement between the grantees that are funded and universities and other government entities.
Hi, good morning. This is Olga with Climate and Energy Project, and I was wondering if out of the issue areas that you discussed, there were some that were higher priority or to precedence.
Not in our minds. There are none that take priority or precedent, and the issue areas that are identified in the RFP are not an indication that those are ones that we would prioritize. We will really be looking at the proposals, the extent to which the applicants demonstrate that there's a need and demonstrate the potential for action in the issue areas. So, on the scoring, issue area is worth 10 points. That's not, we think criminal justice is a 10. At the outset, it's the extent to which the applicant demonstrates kind of an understanding of the issue area, as Alina mentioned, kind of how that issue area intersects with other issues, and kind of just our sense of extent to which that applicant can kind of move things forward around that issue area. It might be Melody. Yep, there's a question.
Good morning, Melody McCray-Miller, Board Chair of the Urban League of Kansas. And on the second and third year, I'd just like a little bit more information in regards to grantees will implement policy and systems campaigns related to their issue areas and other strategies that advance health equity. Will those strategies and that advocacy dovetail into everything that Kansas Health Foundation is currently doing? And when you say policy, it could be at the local level, at the state level, and within any entity or organization in terms of looking at policies and procedures. I just wanted a little bit of clarification. Thank you.
Sure. So we believe that the entire initiative will certainly be focused on capacity building, and that will be an opportunity throughout the full 3-year period. By year 2, we would anticipate that the organizations want to start using some of the grant resources to address the issues you care about in a more intentional way. So in terms of the policy and advocacy and work that is supported through the grant, that will really reflect the work of the grantees, the work of the grantees and the partners that are working on different issue areas. So we do not have specific things in mind. It would really be support for the organization, building capacity, and in moving forward potential solutions to the issues that you care about. And that can be at the local level, it can be at the state level, it can be at the organizational level. So we have a very broad view of policy and advocacy and systems change, and it can be all of the above in terms of local, state, or organizational policy change.
We have an online question.
We have an online question.
The question is from Jamie Coughlin. Point of clarification, will the grantees be working together in some way? And if yes, could you say more about how KHF would like to see that play out?
Sure. We believe that an important component of this initiative is the connection that will be made among the funded organizations. The connections that will be made between the funded organizations and the foundation, and some of the other health advocacy organizations in the state that may not be funded but are certainly important to addressing health issues across the state. So how do we want to see that happen? We're going to build in some specific things like convenings, like calls where we bring everyone together, but in a lot of ways, it will be the work of the grantees to identify how they can best partner with one another and leverage strengths with one another. That's where the movement component that Alina mentioned comes in, and how we believe this initiative will help strengthen a movement. It will do that in a couple ways. One, and well, I guess first, there's an assumption that we have that there are existing organizations in the state of Kansas that are well positioned to address health disparities. So we believe that, and we want to invest in a number of those organizations. We believe that many grants, many funding streams that you have are tied to specific outcomes and deliverables at the outset, and maybe there's a limitation in using funds to address some organizational capacity issues. So we wanted to ensure that this was a different experience for you, that you could use grant funds to build organizational capacity. That creates, future strength, future opportunities. And we also believe that there's, power in numbers, that you will be more effective making progress to the issues you care about if there are other organizations, if there are other people who also care about those issues. So through this project, building organizational capacity is an important component, and then working together with the grantees to figure out how we can strengthen those connections, those networks, those coalitions, so that we can all have greater collective impact. And to answer the question, we don't know exactly how we will do that. We're going to create space for those conversations and think that that would be work that we would do over the 3 years. And
Kathy from Central Kansas Foundation. Can an organization be both an applicant and a partner?
yes. Can an organization be both an applicant and a partner? Yes, definitely. Okay, yes. Two questions up front here.
Are there any limitations regarding the organizations and non-for-profit, but working across those governmental collaborations, whether that be schools, health structures, court systems?
No, there are no limitations with the partners. The limitation is just who the funded organization would be.
Okay, thank you.
And there's a question right up front here. 2 questions right up front.
Hi, Kathleen from Interfaith Ministries. Could you elaborate a little bit more on the capacity building part and the budget? Like, what will you pay for? What won't you pay for? Will you pay for software kind of things?
Let's hold that question until after Bonnie provides an overview of the CCAT. Generally speaking, the capacity building support would be to help shore up organizational capacity across the areas that Bonnie will be talking about. And just to answer your question, I mean, software, IT purchases could be supported through the grants. Two more questions. And we've had a question here. Go ahead.
Okay. Barb Andrews, Episcopal Social Services. In listening to you, we're building the bridge as we go on this grant, so it'll be kind of hard to project budgets for the 2nd and 3rd year. Will you give us some instruction on that? Because
plans and budgets for years 2 and 3 are not required with the proposal. So we will work with the grantees to develop those. Yes, sir.
Big with Project Access. If our organisation geographically could support just one county, is that still deemed eligible?
Yes, there are no geographic limitations to the grants.
And if your funding is provided also by city and county, that's no problem there.
No problem. Okay. No, we anticipate many of the organizations that will probably get some state funds. Okay, I think these were great questions. There will be time after Bonnie for additional questions. But we wanted now to allow Bonnie to talk about an important component of the proposal process and what will help frame the capacity building component of the grant. So, Bonnie, if you could introduce yourself, and we'll advance your slides. And then pause for questions. Great.
Great. Thank you, Jeff. This is Bonnie Mazza from TCT Group. I'm the Associate Director of our Nonprofit Strategy and Capacity Building practice at the firm. We work with foundations, nonprofits, and corporate social responsibility programs, all with a lens towards increasing impact in the social sector. So very excited to be sort of with you in the room today. I'm going to rely on Jeff and Alina to be my eyes in the room and let me know if folks can't hear or if there's a lot of questions popping up. But let's go ahead and talk about this CCAT thing that you've been hearing about, our core capacity assessment tool. You can advance the slide. So we're going to talk very quickly a little bit about the context for CCAT and actually everything that you've heard so far today in this meeting. I think you're going to see really kind of relates to the CCAT. When we think about a grant that's about building infrastructure and nurturing leadership, these are things that very much come up in the CCAT as a way to get a sense of where is that going and how would we prioritize what we want to do. I'll give you an overview of the tool itself, both in terms of the report that you're going to see, as well as the methodology that kind of built that report, and how we think about prioritizing the capacities that you'll work to build and create sort of the narrative for you. And finally, we'll talk about the timeline for the CCAT administration and some of those critical next steps in moving forward with that. Next slide. Great, so in terms of the context, you just heard quite a bit of context around sort of the goal of Kansas Health Foundation here in terms of designing a customized capacity building initiative for their grantees. This is an opportunity to take this assessment. This is a standalone tool that organizations can take at any time. Sometimes we'll use it in strategic planning. Actually, almost every time we do planning, we use it. And then folks also use it to help kind of think about the ways in which they would build their capacities and frame a proposal. So this is an opportunity for you to participate in that at no charge, and we'll talk a little bit more about what you'll get. There'll be the report and an interpretation session, and it's really a chance for you to gather some leadership and have a great reflective conversation on the organization. And do some good thinking about where you are right now. In terms of the goal for you as applicants, this tool and the discussion that follows will provide you a framework to really prioritize what the most critical organizational capacities you have to tackle in order to deliver sort of these highest quality services, and really think about particularly the extent to which we've talked in this conversation about the ability to partner with others and collaborate and work towards your impact. This tool will help you prioritize and think about what the actual action steps are to be. So it's one thing to have the knowledge around what capacities we need to build. Then there's that second piece of sort of what would we do, how would we in fact build them, and this will help you get towards both. Anticipated results, the ability for the foundation to know whether or not the way it's providing support is actually working, and anticipated results for you all is the ability to present a strong case for resource investment, be it to Kansas Health Foundation or other funders in conversation with your board. We'll talk about how they're part of this process to really sort of be able to build that narrative and summarize your capacity building needs and how they're prioritized. Next slide. So an overview of the CCAT. We can jump right to the next one. So what is this CCAT thing? The CCAT's an organizational assessment tool. It's a survey, okay? And what it does is give you a sense of overall organizational effectiveness. I'm going to talk a little bit more about what we see as part of effectiveness. About 10 or so years ago, we built this tool in response to requests to have a clean and sort of quick and organized way to think about how well prepared an organization was to carry out its mission, organizational effectiveness, what needed to be in place. We did an extensive literature review. We built on, at that point, 25 or so years of experience in the field, lots of interviews, lots of refining of this tool, and came around 4 core capacity areas, which I'll further define in our conversation, but they are adaptive, the ability to take in data and use it to make decisions; leadership, the ability to set forth a vision and gather the resources to make that vision a reality, both in terms of what you're putting out there and your partnership between your executive and board leadership; management, which is kind of what it sounds like, your policies and procedures that you have in place to manage staff and resources; and technical, which it does include technology as one of a number of things, but these are all sort of the pieces that you think about for any organization to run. We need fundraising, we need marketing, we need outreach, We need to have staff with the necessary skills to launch our programs. And it also takes a look at organizational culture. So, there's, as much as we look at sort of these 4 core areas for effectiveness, we know, and one famous person once said that, Drucker, that culture will eat strategy for breakfast. So we really think about the organizational culture as kind of the sea in which these 4 capacities are swimming. It's a frame for everything else. And so the CCAT does take a quick look at this 5th area of organizational culture. And finally, it gives you a placement on a life cycle stage. And the relevance of this life cycle stage is that it really gives you a lens on the rest of your report. The CCAT is a snapshot of a moment in time for your organization. And the life cycle placement is about where are you right now? What are the things that are kind of most top of mind that you most need to work on or that you're sort of thinking about? So there's 3 areas that it looks at primarily: core program development, infrastructure development, and impact expansion. And I will talk quite a bit more about that piece in a little bit. We can go to the next slide. The purpose of the CCAT, so a quick moment on what the CCAT is not. The CCAT is not a report card. It is not a critique. It is not a test. This really is an organizational learning tool. At the end of the day, it's a self-perception report. So while there's a number of questions in the survey, I'll tell you how many soon, they all relate to an algorithm, various algorithms that create these subcapacities in the 4 core capacity areas that I just talked about. And it really is intended to give folks a moment to reflect on where we think we are doing well and where there are challenge areas. I would anticipate that many of your CCAT conversations are going to be largely affirmative. This is, as I said, it's a self-perception report. You are filling it out, so whether or not you know that you're flagging a certain area when you're answering the behavioral questions that you're being asked, it is likely to sort of help you in terms of kind of affirming what you knew, but giving you a framework and a way to think about it and talk about it sort of in a neutral way. It becomes this framework for facilitating discussion. It is one of many organizational development tools that are out there. One of the unique things about CCAT is we're one of the only ones that actually collects all the responses in a database. So we keep all of the CCATs. Over 5,000 organizations have taken the CCAT. You're able to run comparison reports if you're interested in seeing how you map against other organizations in a similar budget size or within your subsector, and get a sense of that. And it's allowed us to do a lot of regression analysis and research to understand where there are important correlations between, say, a board's engagement in strategic planning and their overall effectiveness for the organization. And finally, it is a leadership tool, and I mean that in 2 ways. In terms of who takes it, it is leadership. It's not a 360, it's more like a 180. We seek to have folks taking the CCAT who are kind of in a management level or above. You have a sense of a lot of areas of the organization, how the board functions, and kind of all the critical sort of executive functions of the organization, if you will. The other way in which it's a leadership tool is facilitating that discussion and being able to speak with your board and with your staff around where you think the organization can further invest, what's going well, where we feel challenged, all of these different pieces. Next slide. So in terms of how it's administered, so I just talked a little bit about who should take it. It is an individual survey. It's taken online, and the folks that will take it are executive staff, management staff, board members, and sometimes, if you like, and if it's applicable, senior volunteers. In this conversation and anywhere in the CCAT, we are not referring to a board member when we're saying volunteer. Ideally, about sort of 9 to 10 people might take it, and 2 to 3 board members. If you have a larger management staff than that, you can certainly be more inclusive. If you are a very small staff or a volunteer-run organization with a working board, we need a minimum of 3 folks to take the CCAT. It is so as I said, it's 183, not a 360 here. All the results in your CCAT report have been aggregated. This is about as anonymous as it gets. There's really, you should not be able to sort of in any way call out who might have said what when you're looking at your CCAT report. It's aggregated across the board. Where folks do not know an answer, if they, particularly board members of the area of the organization they just do not touch, they should skip the question. And finally, there's a background section that is part of the CCAT that asks questions around financial data, size of the organization, sector, and this is what will enable you to be able to pull those comparison reports. You want to make sure you fill this out. You're going to select an organizational lead. This is an administrative role. It can be someone that's going to take the CCAT or not. And they will help set up that background information in the CCAT and also input the names of the folks that you want to take the CCAT. They can monitor the progress and they can send out reminders. So we'll chat a little bit more about that, but that's important for you to know. Next slide. So in terms of what the survey looks like, as we just mentioned, there's the budget and background section. So this is not what the report looks like. This is what the survey itself looks like. So as the administrative lead, you'll see the budget and background section. As a respondent, you'll simply see the survey. It is a 146 question survey. It takes about probably 40 minutes to complete. You can save and come back. And every question has the same scale. It's a Likert scale from strongly disagree to strongly agree. So while there's 146 items in the survey, these are not the lengthy questions. And the items are action or behavioral statements. If you go to the next slide, we can see a sample there. So all staff members are formally evaluated at least annually. So either this is happening or it's not, or we're not aware of it, and we don't actually know the answer, and we would skip. All the questions are sort of statements like this, behavioral statements. You will notice, you'll probably get a feeling at some point in the CCAT, like, did I answer something like this before? There is an intentional aspect of the CCAT that we are asking you questions about similar things in different ways at different points in the CCAT. Some of them relate to different subcapacities, but it also is just part of sort of getting at similar information in different ways to kind of cover for various ways you might do it, and also just to make sure that we're kind of getting a few different angles there. We can go to the next slide. So the report itself, so after everybody has taken the CCAT, you've monitored, everyone is finished, and we can go ahead and close and run. You can download the report. You're able to do that on your own. We're also here to help you if you need. You're going to get a PDF file that you can share with all your respondents who have taken it. What's going to be in that report? The first 9 pages are an overview of the tool. Everything that we've talked about today will be written out painstakingly in that report. It talks about those 4 core capacities, what's measured in culture, talks a little bit about how to read the life cycle, all sort of leading up to the report itself. Your actual report starts on page 10 with your life cycle placement. And again, that comes first as a lens on how to sort of think about the overall report, really gets to that snapshot in time. On page 11, you will have a prioritized capacity building plan. I advise you to sort of skip past that. When we do our conversation, we will skip that, dive into the scores, and circle back to it, but you'll get that summary right up front. And then you'll have a summary page of the 4 core capacities in culture. You can see how you sort of map overall. And then it's going to jump into each capacity and their subcapacities. Underneath, you'll see these recommendations. Recommendations are triggered by something showing up as a challenge area, or it may not necessarily show up as a challenge area, but it may be a subcapacity that is critical to your sort of progression in that life cycle. So how will we move to sort of the next moment in our framing of what we're working on? So say from core program development to infrastructure development. This subcapacity is particularly important to that. While it may not have mapped as a challenge, there will probably be recommendations showing up. It will then go into some more of the theory behind the tool, and it gives you this whole bunch of recommendations that you can look at for both internal things that you can do sort of on your own, sort of lots of it ranges from small sort of tactical things that can actually create quite a bit of change in an organization to larger initiatives. And so you'll see throughout the report there is sort of recommendations that are about things you can do internally and things that may require some outside support. And finally, when you go to download your report, and the organizational lead will be able to see this, you can choose to do the comparisons, and there's a bunch of different ways you can do that, and what that will give you is for every capacity and subcapacity, you'll see how the sort of baseline of the group of organizations to which you're comparing has done an aggregate on their CCAT, so you can get a sense of, we're really having an issue with our technology skills. In fact, so aren't most of the folks in our sector. So, it's a modicum of comfort, but also recognition that this is really a challenge for us and for everyone, and we need to think about how to address it. We can move forward. So here is a snapshot of one of the summary slides. This is the leadership capacity, and shows on it the subcapacities for leadership. So you see that we look at internal leadership, leader vision, leadership sustainability, board leadership, and leader influence. Now, again, when we do the interpretation session following your completed report, we will dig into each of these and talk more about what they mean. You see that there's these scores here. There's very specific numbers. A couple things about that. So those, I mentioned the algorithms and how every question is putting something into a subcapacity that then rolls up into your larger capacity scores. So that's why there's these very specific numbers. Again, not a report card, but what these do is offer you a gauge for where you're mapping in terms of this feels like a strength, or we're saying this feels like an area for opportunity, there's a challenge here. There's 3 buckets in terms of how we think about the scoring. Anything up to a 190 and below is considered, or 189 and below, I should say, is considered that challenge area. There's an opportunity here. So on this slide, you can see leadership sustainability and board leadership are showing up as areas where we can further invest. Leadership sustainability likely relates to lack of a succession plan, lack of bench may show up here. Board leadership, this could be any number of things. Often there's sort of uneven engagement on the board, sounds familiar. And so while some folks are really showing up and being accountable, there's that group that aren't, and so board leadership might show up. But you'll see down below in the recommendations some hints as to what sort of caused these to pop up in challenge areas. Anything from a 190 to a 230 is considered satisfactory, going well. This is something that's working. Are there additional best practices we could adopt and sort of always room for improvement? Yes, but not sort of flagging at this moment. Anything at 230 and over is exemplary. Going excellently. This will be a moment in our conversation to highlight something that you are especially proud of or feel like has really made a difference here that you want to keep doing with your staff and in your organization. We can go to the next slide. And this is a sample prioritized capacity building plan. So as I mentioned, this will show up sort of early in your report. In our conversation, we will sort of skip right past this and come back to it at the end. What the prioritized capacity building plan offers is a summary of the areas where you need to invest most in order to advance in the life cycle. So you may get back to this page and say, hey, this isn't all the challenge areas that we saw in our report. This isn't exactly what came up. It should resonate with what's come up in our conversation, though. And what's being focused on here are the things that are, in fact, sort of most critical to invest in when we think about the overall life cycle piece. They are numbered. They are not, in fact, meant to be sequential, and you may see as many as 10 things sort of on this capacity building plan. And we can move forward. So a little bit about sort of the methodology and how we prioritize. So what is organizational effectiveness? So as I mentioned at the beginning, we created the CCAT to really think about what an organization had to have in place in order to be effective. So when we think about effectiveness, we're thinking about organizations that are able to act upon their mission-based priorities. There's a clear vision. They're able to set direction. There's a roadmap. We have a beacon. We know where we're headed, and we're able to adapt to change. And we don't mean that in an opportunistic way, but specifically, we're able to monitor our relevance. For example, is our client demographic changing? As those demographics change, are we still best able to meet their needs? Do we need to invest in new capacities to meet their needs? Is there something changing in the field about the way that this particular service is delivered? For example, what have we learned in the last 3 years about early child education and how we might need to adjust our approach? All of those pieces. And we feel that organizational effectiveness really relies on the leader, we mean that broadly, leader's ability to mobilize the resources, right? So without the ability to bring together the staff, the volunteers, the funding, the technology, to engage in partnership and collaborate, we are hampered in being able to achieve that vision. So we can kind of think of those two critical components, being able to be mission-focused and have a clear direction and garner the resources that's critical to organizational effectiveness. We can go to the next slide. And you can click right to the puzzle pieces. And yep. So I've been mentioning these 4 core capacities throughout our discussion, and we saw an example of what's measured in leadership. So there are 4 measured in the CCAT: leadership, adaptive, management, and technical. As I said, leadership and adaptive are kind of considered first among equals. You'll see us probably in the interpretation focus a little more heavily there. We have not met an organization that is able to sustain and or grow without strong leadership and adaptive capacities. So that, particularly adaptive, that critical component of being able to read our external environment and be appropriately responsive to the changes taking place, as well as to reflect on what's working and not working internally in our organization, are critical to that success. Again, leadership is about that board and staff partnership and the ability to set and sustain that vision. Management, as I talked about before, is about the policies and procedures and sort of what's in place to manage resources. And technical are all those different pieces from marketing, legal, facilities, fundraising, technology itself, and technical skills. It's kind of about having the right people in the right seats, and having also the critical functions to be able to run the organization. And we can move forward. The life cycle, which I've talked about quite a bit, I just want to make a few quick points here. So there's lots of life cycles out there in nonprofit land, right? And this one is not about the age of the organization. You can have lots of great discussions about, okay, our organization's 3 years old. Our board was a founder board. We're having a moment of change here where we need to think about how our board composition might meet the needs of a more established organization. That is not sort of what this particular life cycle diagram is about. We believe you're functioning in all 3 of these at any given time. And when you see the CCAT report itself, the diagram looks quite different than this. It's a bell curve, actually, with core program development leading into infrastructure development and leading to impact expansion. Organizations can absolutely be brand new and be operating in impact expansion. They can also be 100 years old and be mapping in core program development, engaging in strategic planning, engaging in program strategy, really looking at sort of what are we doing with our programs, revisiting that methodology and thinking about adding new programs or making changes there will show you up and will have you show up in core program development. That is your lens for this moment. It's really about program and mission alignment and that clear sort of understanding of what we carry out in terms of our programs and our understanding of how we want to meet our impact. Infrastructure development are those sort of pillars, if you will, that we build in an organization to be able to deliver on those programs and to deliver on our mission. And impact expansion is, we think of sort of as a ripple effect. So things that could show up here as good work in impact expansion are, partnerships and collaboration, thought leadership in the field. We've found a great new way to think about maternal health, and we want to share that with others. Writing white papers, doing advocacy and policy work, big P or little p, are all sort of pieces of impact expansion. In the diagram that you'll see in your CCAT, it then goes into dissolving and or merging. And we obviously don't think that every organization goes that way, but we do think that there's a danger to resting on your laurels, if you will. So if you picture sort of the recycling logo, that's what we think about with these three. We are always thinking about these three. We get into impact expansion, we've grown, we've scaled, and all of a sudden we find ourselves thinking again about our programs and what they need to look like. And as we build new programs and reach new audiences or shift programs, we are right back to thinking about how has this changed our needs for the type of staff we have, for our technology and the way that we use it. So let's move forward. I'm just conscious of the time here. As I mentioned, the life cycle. Yeah.
Real quick, before you wrap up, I just wanted to make sure everybody knew that the Kansas Health Foundation has been working with TCC Group and incorporating the CCAT into our work for many years. We're also not asking you to do anything we haven't done ourselves. There's a version of the CCAT that was designed for foundations called the FCAT, right? And we've taken the FCAT. We found some areas where we scored below that 190 range. We developed some plans around those, really trying to shore up those areas. I think there were a couple things where like, yep, okay, we knew that, a couple other things that we hadn't known, and that allowed us to really target some of our efforts. So I think definitely take the CCAT in the spirit of moving toward a more effective organization. It's not a report card. It's not a report card even for the folks to take it to bag on an organization, I guess. It's an opportunity to understand how people think and how to move forward. I also wanted to point out, leadership and adaptive capacity are important components to the CCAT score. And we're sitting in the Kansas Leadership Center right now, which probably has information about adaptive leadership and work back there. So also knowing that through this grant, when we're talking about capacity building, the foundation, the Leadership Center, and others will be able to provide some support, but we're really looking for you to consider how your organization can best respond to the CCAT results and best, build stronger capacity. Start with your strengths and identify those things where you can build greater capacities. So, Bonnie, yeah, if you could wrap up, and then we'll open it up to CCAT questions.
Great. Should we skip just to the timeline slide then? I think it's about 3 slides. So you will have this presentation. You have the CCAT website, and we're here at the Help Desk to help you. In terms of timeline, you have, I think, 10 days to think about your letter of intent. Once we are aware of that, we will send you an invitation to take your CCAT. As soon as you have had folks finish their CCAT, we will schedule with you an interpretation session, a 60-minute discussion with you and all of your respondents to dig in and make meaning and prioritize the capacities that you want to build and really set you up to work on that proposal. The deadline for finishing your CCAT is October 7th. When you look at the deadline with the foundation, I really encourage you to take your CCAT as soon as possible and have that discussion so you have time to really think about it and continue to sort of build out that proposal. And I'd love to open it up for questions. Thanks, everybody.
Hey, Bonnie, during the first 2 applicant meetings, I think there were questions about the interpretation sessions and how they're organized and what they're like. Could you just tell us a little bit about that before other folks ask questions?
Sure. So it's a conference call. It's 60 minutes, and we will kind of do a quick walkthrough of the methodology. So basically that first 9 pages of the report, we will quickly recap for you. We'll talk about your life cycle. And the interpretation session is really for you as a discussion. So we're there as facilitators. We're going to make sure the report makes sense and so you can understand it and help sort of bring it to life. But then I really try to turn it over to you and your group to further make meaning. So we will pose questions there, you know, what resonates here, what does not, what's the best practice you would highlight, what feels like the biggest pain point, can you bring color to this, you know, leadership, sustainability has come up here, you have a succession plan, what else is coming up for you? So it's a great chance to have a real quality conversation. Encourage you to make sure that your board members that took the CCAT can be part of that meeting so that we can reflect together. And then the objective is for you to leave that discussion with real clarity as to what's prioritized for you, what is the kind of top things that you need to do to move forward. And you have sort of that narrative from the discussion to do that. So we do kind of get right into action steps, like what kind of resources might you need to do that, so that you're pretty set up to then begin sort of writing it out in terms of a proposal.
Great, thanks. There is one question through the webinar from Jamie. Is the CCAT only taken upon submitting the letter of intent, and is it repeated? So the organizations will only receive the link to take the CCAT after you submit a letter of intent. So that will start the process for the CCAT. Is it repeated? For those organizations that are funded, it is likely that we would support repeating the CCAT. We wouldn't do that until 2 or 3 years later. I mean, it takes some time, obviously, to see change, and that would be the focus of the grant. So for grantees, there likely would be a repeat of the CCAT that we would fund. So it's important to think just in terms of submitting a letter of intent and applying. If you're interested in the CCAT, this is something that is free for you. You submit a letter of intent. You can go through that process, learn through the process, and we think it's a benefit. We think it would be something that would be useful to many organizations. So there's that, which any and all of you can take advantage of by expressing interest in the grant. And then, for those folks that are funded, support again. Okay, how about...
And if anyone has taken it before and it's fairly recently, please flag that, because, to Jeff's point, we wouldn't take the CCAT again for 2 to 3 years. If you engage in planning, for example, your scores or your life cycle may actually your scores may go down because you're in there sort of messing around. So that's part of that time frame. And then we do sometimes have folks who've already taken it, and we can sort of integrate that. So do flag that for us if you've taken it before.
Great. CCAT questions?
Hi, this is Debbie from the Wichita LGBT Health Coalition. Is there any studies or citations that you could refer to us based on this assessment tool?
You restate the end of the question. I didn't quite get you there.
Is there any studies or research or any references for the assessments tool?
Yeah, Bonnie, are there published studies that to show how this is a valid tool? Or
not
valid.
Anymore.
Science it up here.
Right, it's hard to hear in the room. Are there published studies? So we have, the tool has been validated. There are a lot of, let me think about if there's a published study of the tool itself. No. There's published reports using the tool. And we go back and have revalidated it several times. So it is a statistically validated tool. Does that answer your question?
Well, it's more like I wanted to read the theories behind it. I just wanted to know about how this assessment works.
In terms of the methodologies, there was the so it's all been sort of validated and studied. There was an extensive literature review put behind that, as well as interviews, extensive testing, refinement in the first couple of years. Is that
Fine.
what you're thinking about?
This is Alina. I think is there a website? Was it the TCC, CCAT.org or something?
To read more about the methodology, yes.
Yep.
We can also send out a sample report, would have that language as well.
Okay. And just for everyone, these slides are available online on our website, and I believe that that website is listed on the slide somewhere in there, so you can go there, and there's a lot of information, and there's a sample report.
Mm-hmm.
So information available on the website. Sample report that would provide, I think Bonnie mentioned that the first section just kind of goes into some detail, first 9 pages regarding the CCAT itself, what it's designed to do. If folks on the phone, go ahead and use the chat function to send in your questions. We had some background issues.
Do I understand it correctly that everyone who submits a letter of intent will receive the opportunity for CCAT? Is that right?
Yes, that is our intent. So.
And then I have a follow-up question that isn't CCAT related, but I have a microphone, so I'm gonna.
Yeah, go ahead.
I really don't have a choice. Okay. Also, I'm a board member with Jana's campaign, which does education about gender and relationship violence and prevention. And we were a spring 2016 recognition grant recipient, so I wonder if we are eligible to apply for this also.
Yes. Previous or existing funding from the Kansas Health Foundation does not impact your ability to get a grant through this initiative.
Hi, I just want to make sure I understand the relationship between CCAT and its results and the likelihood of being funded or not funded for the grant. This looks like an excellent tool to use independent of this grant regardless, but are the results from the CCAT then a determining factor for KHF to use in determining who the grantees are?
No, the results themselves are not. It's the applicant's response to the results. In that vision for capacity building, what's your plan for responding to the CCATs? That's what we're looking for. But there's not a threshold. There's not a score above which we'll fund and below which we won't.
And I'll just back that up. That's an excellent question. We actually, when we built this tool, it was a concern of ours. We don't enable funders to use it as a decision-making tool. What we really love about it and our hope here is it puts you in the driver's seat to say, this is what we need funded for our capacity and why, which is a shift in the sector from foundations historically sort of determining what they were going to invest in for capacity building. So an exciting way to sort of be able to say, we have an individualized plan within a larger initiative, and this is what would get us where we need to go.
And also I'll add that the external reviewers will not have the CCAT scores, so that will not be a determining factor in getting funding.
Good morning, Diana Shen with the Child Advocacy Center. Just curious, will this be an opportunity that's only once, or do you anticipate this being offered in years to come?
I mean, this is we know it's here now, I guess. More to optimize this opportunity, unsure what we may do in the future.
Hi, Tamara Eppner with Trust Women. Is there a minimum or maximum amount of people that need to take the CCAT to affect the results?
The minimum is we need 3 people to take it. In terms of a maximum, there's not a maximum. I would just think about it is 40 minutes of folks' time, so it can be used as an engagement tool. when you get past sort of 15 or so people, that because it's an aggregated study, there's not a ton of additional added value. So I wouldn't feel pressed to get sort of everyone to take it. It needs to be critical leadership that has a clear understanding of the organization and a couple of board members. Staff to board ratio should really be no more than 3 to, or no less than 3 to 1. So about 9 staff and 3 board would be great. We don't want to have board outside staff unless we have a situation where we have a working board that is a sort of more volunteer-driven organization with a working board that's a different scenario. We can talk about that. But in general, want to sort of keep the staff at least 3 times the number of board members involved.
Any other questions from the phone?
Nothing there.
Question in the room. Great.
This is Joy Mark from Families and Communities Together. If that ratio is impossible because there's less staff than board members, what would your response be?
Can you restate that one?
On the recommendations for who takes the CCAT, if there are less staff than board members, what would your recommendation be?
If there are fewer staff and board members?
Yes.
So then have the staff that have clarity sort of around the management piece take it, and then maybe just 1 to 2 board members. Are you in a situation where you have a single, primarily an ED and then a board, and then support staff or not? Is that?
Could you repeat that, please?
I'm just wondering if the question is if you are if the situation is if you have so we've had like chapters say of different organizations take it, and we have sort of maybe 1 ED and they are the staff and then they have a board. So that might be a situation where you have more board than staff looking to take the CCAT. So in that case, I would say have the staff member and then few of the close working board take it. We need that minimum of 3, but it would not necessarily have the whole board participate. The reason we don't want board to outbalance staff, a big part of it is because there's a number of questions board members will likely need to skip where they aren't as close to the day-to-day within the organization to know how things are managed. And then it really is meant to be that larger staff perspective. Does that answer your question?
Yes, I think it did. Yep, it did. Great, thanks.
And I know I heard in the questions earlier, at least one group mentioned being a university or associated with a university. So we can talk more about that. Obviously, the governance structure can be different there. So you will want to sort of think about how you are defining for yourself board leadership when you're going to take the CCAT. But we have had lots of organizations that are embedded within universities and or sort of departments take the CCAT historically and are able to get good use out of that. But if you have extra questions as you go to think about who takes it, feel free to drop us a line.
Great. Well, I will just reiterate that our website has a running list of questions that have been asked. So refer to that. We will add questions from today there and add additional questions, including the one about to be asked.
It's very brief. People are called to a Black Women Empowered Incorporated here in Wichita. I'm just asking for informational purposes. Once the CTAC has been taken, is it printable?
Well,
is it what?
Can it be printed? The CCAT report is a PDF.
Oh, printable, yeah.
Yes, that you'll have, and yep, you can print it. You can disseminate it electronically. It will be a PDF document. Yep.
Jeff, we have an online question. Oh, sure. We have another question from Jamie Hoffman. Confirming I heard this correctly, the scores are not shared with KHF and therefore not included in our app scores. but our responses as an organization does count?
The scores, we anticipate that the proposals will be reviewed by a combination of foundation and external reviewers. The external reviewers will not have access to any of the CCAT results. I believe the foundation would have some summary.
Yes. So
There's an aggregate.
yes, as an aggregate. So one of the documents that PCC Group will provide everyone once you complete the CCAT, and one document that's actually already available on our website is the waiver, and that allows PCC Group to share their aggregate results with KHF. Those stay with KHF, those don't go anywhere else. Again, they're not used for scoring. That's more for us to kind of see where are nonprofits, kind of where what are the existing needs, what are the strengths. We're working with PCC Group to view those results by issue area. Are there certain issue areas that are more developed than others? And really that's to help inform our future work and our future endeavors. So we ask if you would feel comfortable to please fill out that waiver and share those scores.
And if I may, I know, we said this is not a report card and all that, but there truly is not a wrong answer in CCAT. And when something flags as a challenge area, we seek to sort of understand why that is and how we might invest to correct it. So a very quick example, I had an organization who's, for face value, to look at the scores, very low across the board. Turns out they had a lot of ED transition that had happened, but they also had a lot of opportunities happening. They had the new person coming in. There was likely to be positive cultural shift after a 30-year tenure where things had been sitting a little bit. They had brand new facilities, and so they actually had a ton of opportunity in those facilities, but it had caused quite a disruption in how they might do their programming and what their capacity needs were. So there's always a story with the CCAT, and that is what we're aiming to help you sort of be able to tell and to really explain, this is why we think investment in this area is so critical. These are our strengths on which we're building, and these are the challenges we're looking to sort of overcome. These are the opportunities we have. So I know it looks like a report card and feels like a report card. It truly is a tool to sort of start telling that story in a well sort of framed way.
Another question.
Yeah, Stephanie with Midwest Valuation Research. I'm imagining these aggregated scores that they're depicted visually, kind of as a picture. Is that correct? Do you know? If that is the case, are these going to be disseminated via social media as well for our use and also dissemination?
Well, so I'm not sure how the aggregate scores, they'll be depicted visually. We have no intent to disseminate the scores in any way. So thanks to Alina for reminding me, the waiver will allow KHF to see scores, and we want to use that as we're thinking of additional capacity building work that we can support. Some of you may have received a link to a survey where we were asking some questions designed to help us better understand the needs of nonprofits across state. So the CCAT is kind of that process, amplified, and allowing us to see the results helps us gain a broader understanding of the needs of nonprofits. And as Alina mentioned, perhaps even looking at differences across different issue areas where we may need to invest funds. But we're not going to disseminate the results in any way, social media or otherwise.
So what we do with those is our choice, perhaps?
The CCAT, yes, the report, the results, they're yours. They will be, owned by the organizations that take them, and you can use them, disseminate them as you.
I just think it would be interesting for other people to see how we are as a group. If there's any, similarities and whatnot, sometimes useful for others across the comparison.
So I guess, that's a good point. Julie did mention that there's an opportunity to look at an organization's CCAT results in the context of their sector or a similarly sized organization. So for the organizations that take the CCAT, I think there would be an opportunity for you to compare your organization to similarly situated organizations. So that would be something that...
Right, and that is done with, there has to be at least 5 organizations in your comparison piece. You will not know who those organizations are, and other than sort of the clues you have from the parameters that you set. So any organization that's ever taken the CCAT while you exist in the database is completely anonymously, and we make sure that comparisons can't be run if there's simply not enough organizations in that specific niche area. And to answer your broader question, to be compared to the overall cohort that took this, there will not be sort of that direct comparison for you to pull.
Okay. Well, on behalf of the foundation, thanks for being here. Thanks for your interest. Some timeline things to keep in mind here. LOIs due August 22nd, and you need to have your interpretation session with TCC Group completed by that October 7th date. Don't wait to schedule it on that day. It needs to be completed by that.
So just a couple of additional things. Like we said, this webinar or this session will be, it has been recorded, it will be posted online. So if you want to go back and look at anything you're doing again, the slides are all online, the waiver is online. I have taken notes on every question and every answer asked. Those will be added to the FAQ document, which is updated a couple times a week. Also, in the last 2 applicant meetings in Garden City and Topeka, folks asked that we send out a list to everyone who attended of who all was there, so organizations could partner with one another. So we did that for them. We'll do this as well. If you don't want your name, your organization, the fact that you were here shared with others over here, please let me know, and I'll make sure to remove you. But this is a way for folks to get together and partner if need be. So, and reiterating, Jeff, thanks for coming.
Thanks. Thank you.
Smooth. Thanks to your